Tonight, we're talking about mental health. A new state report recommends Indiana make systemic changes to its mental health care system. Along the findings, we learned 20% of Hoosiers lived with untreated mental illness. WHAS 11 reporter Connor Steffen has a closer look at the issue and what comes next. Connor.
Well, Tom, mental health professionals say Indiana's long had an outdated system. One expert even referenced that in 2019, the state ranked 42nd overall in the U.S. for mental health. Now, 3 years later, and after going through a pandemic, they say the problem's only gotten worse. Just over the bridge from Louisville in Jeffersonville, Indiana.
It is very challenging right now.
Inside LifeSpring's mental health care facility, Beth Kenny says there's been a dramatic shift over the last few years.
Yes, so we have seen a tremendous change.
She says the shift started in 2020 when the world came to a stop.
COVID has a lot of consequences.
Impacting all ages, demographics, and lifestyles, and impacts not just at her business.
Across healthcare systems.
We have to look at new interventions, and essentially that's what this report says.
A report Indiana's Behavioral Health Commission released this month. Its findings, 20% have untreated mental illness. The consequences, be it incarceration or unemployment, cost Indiana $4 billion a year. It's why the commission is recommending Hoosier leaders make significant changes to substantially improve services across the state.
This is a roadmap for behavioral health for the future.
The recommendation focuses on two key areas. First, creating a statewide crisis response system in Indiana following the national rollout of the 988 hotline.
So if we can meet people where they are, we're going to be able to do better at getting them care.
Its second recommendation is something called Certified Community Behavioral Health Centers.
And what CCBHC does is set forth a set of standards and services to be provided in community mental health.
Outreach efforts that include things like free mental health screenings, assessments, and treatment. The 60-plus page report includes hundreds of potential solutions. But professionals note that recommendations in this report right now are simply words on paper.
We would see significant increases in healthcare access as well as better health outcomes for Hoosiers.
The action of actually doing it is going to be on everybody.
So with that in mind, Connor, this outlays what people could do, but what actually comes next?
So the state appointed committee did its job, made its recommendations. Now it's in the hands of the state. So lawmakers will go through those recommendations, decide what to implement and where the funding could come from. Beyond that, it's just about waiting until they get to that point in the process.
All right, thank you very much. And we also want to let you know, if you or someone you know is struggling with mental health, a new hotline was established for suicide and mental health crises. That number is 988, and it'll connect you with a part of a national network of more than 200 crisis centers, including one here locally.